I have a question. So in Romania, there are waiting lists.
Sure.
Patients are waiting 4 months. As we discussed in similar to Ireland. What would be, can you explain to the Romanian patients coming from professional high experience, what is the impact on the outcome of the patients when they wait so long?
Yeah. So waiting, if you have, and I kind of mentioned this earlier, that if you have, say, a lung cancer or a cervical cancer or a breast cancer, if you wait, it actually, your outcome, your chances of survival goes down as it goes from one stage to the next. So for instance, if you have a small lesion, small tumor in your breast, let's say it's detected on a mammogram, or you feel a small pea in your breast and it's found to be a cancer, your best chance for cure is when it is as small as possible, when there are no lymph nodes involved, when it hasn't traveled anywhere. But if you don't get treated and you're waiting after you've made that diagnosis, the tumor is not waiting on you to start treatment. The cancer is growing. The cancer is growing, and the longer it grows and the more it travels to the lymph nodes and frankly other parts of the body, once it travels, a breast cancer for instance has traveled out of the breast and the lymph nodes to say the lungs or the bones, it's no longer curable. It can be treated, but it's no longer curable. So head and neck cancer, we want to catch these cancers and we want to treat them as early as possible to maximize the chance of cure. And that's the key, right? Is to catch the cancers early. The hospital here has all the imaging technology. It has a mammogram, it's got CT, it's got ultrasound, it has all the right things to be able to also diagnose those cancers early.
And also
can I put a
yes, please.
Question? If the patient already took 10 days of radiotherapy, and after 10 days, the insurance company say to us, stop. What's happening now?
That is a very terrible thing, right? Because once you start treating these tumors, you need to keep up the pressure. It's like, let's face it, right? Cancer is a war, right? You can't, once you start getting the pressure on the enemy, if you let off, their enemy is going to come back even stronger. And so once you start radiation therapy, you want to complete that course. In fact, you want to complete that course in as short a period of time as possible. So if the radiation typically is delivered over 6 weeks, and you decide, or somehow it takes us 8 or 10 weeks to do it, the chances of curing you actually goes down. So it really is important that once we start radiation, one, that we start radiation as soon as possible, and number two, once we start, that we get through that as quickly as possible without break. So it's really important. And so an insurance company that does that would be actually putting that patient's life at risk, and that's not a good thing. They're in a battle with cancer. It's no need to add that to the battle that they already have, because it is actually a war.
Yes, thank you.
Yeah. You're welcome.
I just wanted to say one word to all the residents of Cluj, that if Dr. Heron and I, we said that if we have cancer, we'll be very comfortable getting treated here.
Absolutely.
That tells you something, right? So as a resident of Cluj, if this is not something you want to have, but should you have it, you don't need to go to Turkey. You don't need to go to Germany
Or the UK.
Or UK.
Or Austria.
This is right close to your home. You come here every day, you go home at your own and sleep in your own bed with your own family members. Nothing can be more,
The support of your family.
than it can be. So that's what I would say from me in closing statement. That speaks volumes.
Thank you, both of you, for being such good friends,
Thank you.
professionals. I just want to tell everybody in Romania that Romanian patients deserve the best of care.
And say it also in
Pacienții români au nevoie de cele mai bune tratamente. Nu are nimeni în lumea aceasta dreptul să aibă acces la aceste tratamente. Nimeni. E crimă ce se face.
Best quality of care in Romania, that's the way. Not go abroad.
they